Okay. Hey guys, so today we'll be discussing the hand. All right, so let's get started with the hand. Now, the first thing we're going to be talking about, basically the hand is used for power grip and the precision grip. The power grip is just like for strength and the precision grip for precision. So the first thing we'll talk about is basically the movements. When it comes to the movement of the hand, we're going to have to differentiate 2 points, the movement of the normal fingers and the movement of the thumb. So let's start with the normal finger. On the normal finger, we're using an axis, which is going to be the middle finger in the midline. So whenever we're discussing an abduction of the fingers, we're basically moving them away. The AB abduction is away from the middle finger, right? Now, whenever we're talking about adduction, we're moving them towards the middle finger. And flexions and extensions for the fingers will be basically at the joints. Is going to be flexion and extension. Now, when it comes to the thumb, we're going to basically do something similar. Flexion, when it comes to the flexion of the thumb, we're basically flexing at the joint, which is going to give something like that. And when it comes to extension, we're extending the joints. And for adductions and abductions of the thumb, we're basically either moving it away from the hand or towards the hand without any flexing of the joints. So an abduction is away from the hand like that without flexing the joint. And an adduction is going to be adding it towards the hand without flexing of the joint. All right, so let's start talking about the bones first of all. First, look, guys, at this part of the picture. Now, I got this one from the slide, but let's start by this one. Okay, so now when it comes to the bones at the hand, we're going to start with the carpal bones that are going to be located around this region, all right? So we have 8 carpal bones, and we're going to get to them in a second. But for now, just focus on the main idea. So we got 8 carpal bones around this part. Now, anteriorly, or posteriorly, the carpal bones are going to create something called the carpal arch, as you can see right here. It's created by the posterior parts of the carpal bones, or like the superior ones right here, which are going to be the hamate, the capitate, the trapezium, and the trapezoid, which is creating this arch on the back. Now, anteriorly, there would be nothing supporting it. So what we're going to have is that we're going to have here a piece of fascia that is basically like closing up the arch and creating a tunnel underneath, referred to as the carpal tunnel. But we'll get into that in a second. So we have 8 carpal bones. Connected to these carpal bones, we're going to have the metacarpals, 5 metacarpals. The metacarpals are basically extending from the carpal bones until we start the fingers. So these are going to be our metacarpals. Now, naming the metacarpals is going to be the first metacarpal is the one going to the thumb, and then the second to the index, and then the third, the fourth, and the fifth, right? And then connected to these metacarpals will be the fingers. So the fingers are divided into phalanges. 1 proximal phalanx, middle phalanx, and a distal phalanx. So all 4 fingers will have 3 phalanges, proximal, middle, and distal, except for the thumb is going to have a proximal phalanx and a distal phalanx. All right, now this is basically a general overview of the bones. So let's look at the joints. So we said, first of all, we're going to have the carpal bones connected to metacarpals beside the carpals, metacarpals. So carpals and metacarpals are going to create a carpo-metacarpal joint. Metacarpals and the phalanges are creating a metacarpo-phalangeal joint. A phalanx and the phalanx are creating an interphalangeal joint, and then a phalanx and the phalanx are creating another interphalangeal joint. And since we got 2 interphalangeal joints right now, to differentiate between them, we're going to name one a proximal interphalangeal joint, and the next one is going to be the distal interphalangeal joint. And again, for the thumb, since it only has 2 phalanges, it's going to have only 1 interphalangeal joint. Okay? Now, when it comes to the carpal bones, it's going to sound like a lot, because carpal bones, like, for me personally, when I studied them, I didn't like take it one at once and try to memorize them all, because that's a lot. You basically want to try to divide them into few bones. Okay, so let's start. Like for me, how I studied them, I started first of all by memorizing the scaphoid and the lunate bones. These 2 are the most important out of the carpal bones. Why is that? Because the scaphoid is the most fractured bone, and scaphoid is located near the thumb side or the radial side. As you can see at the bottom, I tried to help you guys, but this, like, it's the way that I memorize it. The thumb side is always connected to the radial bone or to the radius, and it's going to have the scaphoid bone. Along these, since it's on the radial side, it's going to have the radial arteries or the radial nerves. For the pinky side, it is going to be located on the ulnar bone side, which is going to have the ulnar artery, the ulnar nerve, and 2 bones, the pisiform and the hamate of the carpal bones. Okay, so far we know 4 bones, the scaphoid, and right beside the scaphoid is the lunate. The lunate bone is the most dislocated bone. And then beside the lunate, since now we're at the ulnar side, we said ulnar side is connected with the pinky, the ulna, and 2 bones, the pisiform and the hamate. Okay? Okay, so the other 4 bones are going to be the ones that are creating the carpal arch. which are basically going to be the hamate, the capitate, the trapezoid, and the trapezium. Now, the way I memorized them as well, it's like when you mention them all together, the hamate, the capitate, then the trapezoid, then the trapezium. You know the way you're pronouncing it, hamate, capitate, trapezoid, trapezium. And these are the bones that are creating the carpal arch. Okay? So try to remember this part, that the thumb side is going to be connected to the radius and the scaphoid bone, which is going to have the radial arteries and the nerve. Beside the scaphoid bone, which is the most fractured bone, you're going to have the lunate bone, which is the most dislocated bone. These two are like very important, and you're definitely getting questions about these two. And so you're going to have the scaphoid and the lunate, and then you at the ulnar side, you're going to have the pinky, the ulnar arteries and nerves, and then you're going to have the pisiform and the hamate bones. Now, I brought on the top side a mnemonic for you guys to memorize it, but personally, I didn't use the mnemonic. It's just basically scaphoid, the S, the long is for the lunate, the T or the 2 is for the triquetrum, and the pinky for the pisiform. And then you're going to have the hamate, the capitate, trapezoid, trapezium. Here comes the thumb. All right? But just try like to memorize them individually. Okay. Now, this is basically an X-ray view of the bones. This is the radius, which is going to have the scaphoid. Beside it is the lunate, the most fractured and most dislocated bones. And these are the rest of the carpal bones. And right here is basically, as we said, the carpal arch posteriorly is created by the bones, but anteriorly there is nothing. What we're going to put over here is a fascia called the flexor retinaculum. Okay. All right. Now, for the joints, basically each joint or the metacarpophalangeal joints are going to be covered by a capsule. Inside this capsule, we're going to have a palmar ligament, which is connecting the palm of the hand, which is basically the metacarpals, with the fingers. So the palmar ligament. And between these metacarpophalangeal joints, we're going to have another ligament, which is the transversely going metacarpal ligament between the metacarpals. Now, before we start going about the muscles of the hand, there is this small concept that we need to understand about the flexor digitorum muscles and the extensor digitorum muscles. So from the anterior forearm, we said there's two muscles that are going to be coming over to the digits, the flexor digitorum superficialis and the flexor digitorum profundus. Now, their attachment site is important. So basically, the superficialis is the one that's going to be superficial. It's going to come over all the way to the middle phalanx, and it's basically creating a split while it's attaching right there. And then the profundus is going to go underneath this split and attach at the distal phalanx. All right. So we said the superficialis is going to come over, split at the end, and then attach at the middle phalanx, creating a space underneath where the profundus is going to pass underneath it to attach at the distal phalanx. Now, as they're passing through this area, they're basically going to be covered by a synovial sheath, and they're going to be also at the end covered by a or the fibrous sheath. Tendonitis is basically referring to inflammation of the tendon. Anything that ends with itis is inflammation of the tendon. So synovitis is inflammation of the synovial sheath. Tendonitis is inflammation of the tendon. Now, for the posterior side, the extensor digitorum muscle, what's going to happen is that the extensor digitorum muscle is basically going to expand around this part to create an extensor hood. Why is this extensor hood very important? Is because most of the muscles of the hand are going to basically attach over at the extensor hood. Right? So posteriorly, the extensor digitorum is going to pass over and attach at this part at the distal phalanx, and it's basically going to create an extensor hood or expansion, which is basically the extensor hood for the muscles of the hand to attach. Now, this is basically a summary for the muscles, the flexor digitorum superficialis and profundus. I just pointed out where you guys should basically like the distal attachment that you guys should know. So the superficialis is at the middle phalanges, creating the space for the profundus to pass underneath, which is going to attach at the distal phalanx. And then the extensor digitorum are going to create the extensor or the expansion around these digits for the attachments of the muscles of the hand. Okay, let's start with the hand muscles. So the first two hand muscles are going to be the interosseum.
Can you repeat the part before this?
This one, or like
No,
the way how the muscles attaching.
No, bad slide.
This one.
Hi. Yes.
Okay, so the extensor digitorum muscle, as it's going to be passing over around the hand to attach at the fingers, so that you can extend your hand or extend the digits. I mean, what's going to happen is that it's going the tendon is going to expand, which is going to basically create something called the extensor hood, which is basically around right here. Okay, so as it's coming over, there's going to be an expansion around this region. And now, what's the significance of the extensor hood is that the muscles, these are the muscles of the hand, they're going to attach at the extensor hood. Okay, is it clear?
Yes.
Yeah. 1 second. All right. So the first, let's talk about the muscles of the hand. The first two muscles are going to be the dorsal interosseous muscles and the palmar interosseous muscles. So interosseous muscles are basically they're between the bones. Inter is between and the osseous is between the bones. Now, a mnemonic to memorize the function is DAB and PAD, DAB. So the dorsals are responsible for abduction and the palmar are responsible for adduction. Now, in order to know where the muscles are coming from and where they're attaching, the way I memorized it is that palmar, PA, so there is an A. So it's going away from the middle finger. So palmar interosseous muscles are the ones going away from the middle finger. So let's start with the first finger, which is basically the thumb. So we're going to have the muscle coming out here from the metacarpal, right? And it's going to go away from the middle finger. So it's going to come over, attach at this side. And then we're going to have the second muscle that's coming over to the pinky. And it wants to attach away from the middle finger. So it's attaching over at this side. And then the third muscle, which is going to attach away from the middle finger, is over at this side. And then the last muscle, which is going to attach over at this part, right? So we got one that's going to attach over at this part, and one's attaching over at this part, and then we're staying away from the middle finger, and then one's attaching over at this part, and then one's attaching over at this part. So the first one, or the palmar interosseous muscles attaching over here, it's not really significant and it's not counted as much. That's why you can see in the picture that Dr. Atif only mentioned the ones attaching here and here and here. Okay, and again, PAD, pad is for adduction. Now it's going to be a little weird, like to know that the pad is away from the, or like away from the middle finger, and then pad is for adduction. But if you consider it this way, so if the muscle is attaching over at this part, right, it's coming from the metacarpal and attaching here. When you contract it, what's going to happen? You're basically pulling it forward, right? You're pulling it toward the middle finger. So that's why it's an adduction. That's a way to make sure of that you got it right. Now for the other muscles, which are the dorsal interosseous muscles. So the dorsal interosseous muscles, they are basically more posteriorly or on the dorsal side of the hand. So the dorsal interosseous muscles are going to be going towards the middle finger. So we got the muscle coming over here that's attached basically around here towards the middle finger. Between these two, it's going to go over this part. Between these two, it's going to go over this part. Between these two, it's going to go over to this part. Between these two, it's going to go over to this part. Okay, so towards the middle finger, towards the middle finger, towards the middle finger, and then towards the middle finger. And the function for the dorsal interosseous muscle, if basically we consider a muscle that's coming out from this part and attaching over here. And so when we contracted, what happened is that we put the hand away, we put the digits away. So it's for abduction, right? This is abduction. Okay, you guys got this point? Now, one thing worth mentioning as well is that the radial artery. So again, radial, we're talking about the thumb, radius side, radial artery. The radial artery, as it's passing anteriorly, it's gonna go, when it reaches this part, or like when it passes the carpal bones, it's gonna go behind the carpal bones to enter into something referred to as the anatomical snuff box. We'll discuss it in a second, right? So it goes anteriorly, passes posterior to the anatomical snuff box, and then goes again anteriorly to the hand. When it does that, it's gonna pierce through the first dorsal interosseous muscle because it went posteriorly, and now it's gonna enter again. It's piercing through the first dorsal interosseous muscle, and then it's gonna be over at the palmar region again. Was that clear? And this is basically a summary for the muscles. All right, the next muscle, which is basically a small muscle, is going to be the adductor pollicis. It's gonna attach at the middle metacarpal and then over at the capitate bone. Okay, so it's gonna, from its name, adductor pollicis, anything refers to a pollex is basically the thumb. So from the middle sides, attaching at the thumb. And what's it gonna do when it contracts, since it's over here? When you're contracting it, you're basically putting the thumb towards the hand or towards the middle finger. And basically this is of an adduction motion. All right, so it's basically adducting the thumb, adductor pollicis. All right. The next muscle is going to be the lumbricals. Now, the lumbricals is a really, really important muscle that you guys should focus on, mainly because of its function. So the lumbricals are going to be starting over from the flexor tendon or the flexor digitorum superficialis tendon. Okay, yes. So they're starting over from the flexor digitorum profundus. My bad. So the flexor digitorum profundus tendon, and then they're going over to attach at the extensor hood, right? So they're starting over from here, and then they're attaching at the extensor hood. Now, the function of the lumbricals is very important. They're going to flex at the metacarpophalangeal joint and extend at the interphalangeal joint, which is going to create this type of form or this type of motion. So whenever you see a picture of a person doing this, you basically want to think about the lumbricals. They're flexing at the metacarpophalangeal joint and extending at the interphalangeal joint. They're going to start from the flexor tendon, flexor digitorum profundus, and then attaching over at the extensor hoods posteriorly to flex at the metacarpophalangeal joint and extend at the interphalangeal joints. It's coming over from the flexor digitorum profundus tendon over to the extensor hood and flexing at the metacarpophalangeals, extending at the interphalangeal. It might come in an OSP question, or like it might come because it's definitely gonna come. All right, now the last two muscles is the thenar and the hypothenar muscles. Now, when it comes to the thenar and the hypothenar muscles, you don't really need to differentiate them. Basically, you just need to know that the thenar from TH, so TH thenar, thumb TH, so thenar is at the thumb region, and then the hypothenar is going to be at the pinky region. It's basically this bulge of muscle. What you need to know about these muscles is basically what they're composed of and their supply. So the thenar muscles are made of the opponens pollicis, the abductor pollicis brevis, and the flexor pollicis brevis. And then you should also know the function of each muscle, which is written right here. For the hypothenar muscles, there's the opponens digiti minimi, the abductor digiti minimi, and the flexor digiti minimi, which are going to carry out this function. Now, when it's mentioning metacarpal 5, what we're basically talking about, the fifth finger, so 1, 2, 3, 4, 5. So laterally rotating metacarpal 5. Now, a lateral rotation by the opponens digiti minimi of the metacarpal 5 and a medial rotation of the thumb by the opponens pollicis is going to create this type of motion or the opposition, okay? So the opponens digiti minimi and the opponens pollicis are responsible for this motion by the thumb. Now, for the nerve supply, the thenar muscles, or the ones at the thumb, are supplied by the recurrent median nerve, while the hypothenars are supplied by the deep ulnar nerves. Okay, now this is basically for the nerve supply. When it comes to the nerve supply, what's going to happen is that we're going to have the ulnar nerve coming over from the ulnar side, and it's going to give off two branches, a deep branch and a superficial branch. Whenever you hear a superficial branch, most likely, like probably 99% of the time, the superficial branch is basically referring to a cutaneous branch or like a sensational branch. So a superficial branch is basically referring to sensation at this part. A deep branch is referring to a branch that's going to carry out a motor function. So if we're talking about the muscles, basically doing a motor function, is that going to be a deep or a superficial? It's going to be a deep branch. Now, all of the hands muscles are supplied by the deep branch of the ulnar nerve, except for two groups of muscles, the thenar muscles and the two lateral lumbricals. Now, when it comes to what are the two lateral lumbricals, basically if you stand in the anatomical position where my hand is like spread out like that, the two lateral lumbricals are the ones that are going to be attaching at the index finger and at the middle finger. These are the two lateral lumbricals, which are going to be supplied by the median nerve. And this would make sense if you think about it, because the ulnar nerve is coming over from this side. So if it's going to supply these muscles, or like the muscles around this part, and then the muscles that are going to be coming over from this side, which is basically more closer to medially, it's going to be supplied by the median nerve, which are the thenars and the two lateral lumbricals. All right. And then the next thing is going to be the arteries. Okay, before we talk about the arteries, because of the arteries, do you guys have any questions about the muscles or the nerve supplies?
I have a question about the superficial branch of ulnar nerve.
Yes.
Where does it provide the sensations? I mean,
We're going to discuss that in a second.
Oh, okay.
Any other questions about the muscles? The lumbricals, okay. So the lumbricals, they're attaching, they're going to attach over at the flexor digitorum profundus tendon, and they're ending at the extensor tendon. Flexor digitorum profundus over here, and they're ending at the extensor digitorum tendon. Any other questions?
Is there one pollex muscle that isn't supplied by the median nerve?
What is it?
Is there a pollex muscle that is not supplied by the median nerve?
The median nerve, when it comes to the hand, which is basically the thenar muscles. Yes, there are like other muscles like pollex muscles in the anterior forearm, like the flexor pollicis longus. But honestly, I don't remember what it was supplied by. But when it comes to the hand, the thenar muscles, like just memorize them as the thenar group of muscles, all right? Because that's mostly what you're going to be asked about. You won't get to like name each one unless the question was, what is the compartment of that? What are the muscles that are making the thenar muscles? Then you might have to name them. But like if you got asked about basically a pinpoint at this region, then it's the thenar muscles. Anything else? The slide of the nerves. All right. Okay. So when it comes to nerves, there is basically going to be deep and superficial nerves. Deep nerves are providing the motor function, which is basically the ability to do stuff. The superficial nerves are providing sensation. So on the left side, or on the pinky side, the ulnar side, we have the ulnar nerve. It's going to give off two branches, the deep branch and the superficial branch. The superficial branch will be for sensation that we're going to discuss in the second. And then the deep branch is the one that's going to give off the motor function. So the deep branch is basically going to supply all the muscles of the hand, except for two groups of muscles, the thenar muscles and the two lateral lumbricals, which would make sense because if the ulnar nerve is coming over from this side, then by the time like it reaches this side, they could have gotten other supply, which is basically going to be the recurrent median nerve. So the thenar group of muscles, which is around here, and the two lateral lumbricals, which are going to be in anatomical position, my hand is like that, then this is the first and this is the second at the index and the middle fingers. And the thenar muscles, these guys are supplied by the recurrent median nerves. Everything else is supplied by the deep ulnar nerve. Right.
What do you mean by recurrent? What do you mean by recurrent median nerve?
Recurrent is basically when the nerve like it moves, it goes over its way and then sends another branch that goes back to retrack its course. Then that's a recurrent because it's going back.
Okay, what if we just know the word median nerve? That's it.
You can just know median nerve. Yeah,
Okay, cool.
both know. Yeah, both work. It's not gonna ask you like probably is it median nerve or is it the recurrent median nerve? A median nerve is a median nerve.
Okay, cool.
It's a branch of the median nerve. Okay, I'm gonna start with the arteries now. So, okay, now when it comes to the arteries, we're gonna have two supply: the radial artery on the radial side and the thumb side, and the ulnar artery, which is gonna be on the ulnar side and the pinky side. The first one is gonna be the radial artery. So as we said, the radial artery is coming over from this, coming over on the hand. And then when it reaches at the carpal bones, it's going to go posteriorly into the snuff box and then goes back anteriorly, piercing the first dorsal interosseous muscles, the muscles around here. As it pierces the muscles, it's going to create an arch in the palm side of the hand. Okay? And this is referred to as the deep palmar arch. The deep palmar arch is created by the radial nerve after it pierces the first dorsal interosseous muscles. Now, the deep palmar arch is going to go over extending all the way until it meets the deep branch of the ulnar artery. So the main artery forming the deep palmar arch is going to be the radial artery. As it comes over from this side, the deep palmar artery gives off two other arteries. One that's going to supply the index finger, or the pollex or the thumb, which is going to be the radialis indicis, coming from the radial nerve to the index, to principus pollicis, my bad. Which is going to be coming over from the radial nerve to supply the pollex or the thumb. And then the other one is going to be the radialis indicis, which is basically supplying this part, only this half of the, what's it called, the index finger, okay? So the radialis indicis is supplying this half, the lateral half of the index finger and the median and the thumb. Was it clear? So the radial artery is going to go over to create the deep palmar arch after it pierces the first dorsal interosseous muscle to give off two branches, one that's going to supply the thumb and the one that's supplying the lateral half of the index finger, which is the radialis indicis and the principus pollicis. The other one is going to be the ulnar artery. Focus on this part right here, okay? So the ulnar artery is coming out from the ulnar side. As it goes through, it's going to create the superficial palmar arch that's going to connect with the the branch of the radial artery, okay? So the ulnar artery is the main artery that's going to create the superficial palmar arch. Now from the superficial palmar arch, we're going to get branches to the digits, which are basically the fingers, right? So it's going to have the branches to the pinky, branches to the ring finger, branches to the middle finger, and then only the branch to the medial half of the index finger, as you can see right here. So only the branch to the medial side of the index finger, because the lateral side and the thumb were supplied by the deep palmar arch. Okay, this is basically about the arches of the hand and the arteries. Do you guys have any questions about them? Repeat the slide of the ulnar artery only, or you want me to repeat both? Okay, I'm going to go over the ulnar artery. So coming over from the ulnar side, we're going to have the ulnar artery. It gave off two branches right here. One second, let me put my mouse. Okay, so it gave off two branches. The first branch that's going to be coming over superficially, and the second one that's going to be the deep branch. The deep branch is the one that's going to be anastomosing or like connecting with the radial artery, which is created the deep palmar arch. The superficial branch is going to create the superficial palmar arch. Now, the superficial palmar arch is going to give off branches to the pinky, branches to the ring finger, branches to the middle finger, and only branches to the medial side of the index finger right here, because the lateral side of the index finger, was supplied by the deep palmar arch, which came from the radial artery. And the thumb was also supplied by the deep palmar arch. Now, okay, so this is the digital arteries. Now, the common palmar digital arteries and the palmar metacarpal arteries, like they're not as important. Just need to know the digital arteries, that there's going to be giving off a branch known as the digital arteries, which is supplying the digits. Okay, any other questions?
Can you summarize the arteries real quick of the hands?
Okay. Do you guys have any other questions about the nerves? The nerves are clear and the muscles are clear before we get over the arteries again. Okay, so when the arteries, we have two arteries, the radial artery on the radial side, and then we're going to have the ulnar artery on the ulnar side. The radial artery is going to be coming over from the anterior side. When it reaches the carpal bones, it's going to go posteriorly into the snuff box, which is basically right here. Okay, it's going to go over to the snuff box. And then once it goes over to the snuff box, it's going to pierce through the dorsal metacarpal or the dorsal interosseous muscle, the first one. It pierces through it right here to go back to the palmar region of the hand. So it pierces it, and now we're on the palmar region of the hand. What it does on the palmar region of the hand, it goes over, creating this arch that's going to connect at the end with the deep branch of the ulnar artery. So the deep palmar arch is created by the radial artery until the end where it connects with the deep ulnar artery. Now, as it's going over, it's going to give off two branches. The branches will be, the branches are going to be the ones to the thumb, which are known as the principus pollicis artery, and the one to the medial side or to the lateral side of the index, which is right here, the radialis indicis. Why is it known as the radialis indicis? Because basically the index finger is supplied by the radial artery on the lateral side and the ulnar artery on the medial side. So in order to differentiate between them, we're referring to the radialis indicis, or the one on the lateral side that's given by the radius, by the radial artery. Okay. Now it's going to give off other branches such as the palmar metacarpal arteries, which are going to anastomose with the deep or with the superficial palmar arch. Okay. Now the ulnar artery is coming over from the ulnar side, the pinky side. It goes over and create the superficial palmar arch. Another thing to note is that, as you can see, the superficial palmar arch is like, one second, it's like it goes above more than the deep palmar arch. Like the deep palmar arch ends around here, the superficial goes around here. But like that's not why we call it superficial. Superficial is because it's closer to the surface. The superficial palmar arch is going to be created by the superficial branch of the ulnar artery, creating the superficial palmar arch. Now, as it goes over, it's going to basically give off branches known as the digital arteries to the digits. The first one is going, or like two branches to the pinky, two branches to the ring finger, two branches to the middle finger, and then the branch on the side of the index finger the medial side, which wasn't supplied by the radial artery. Is it clear?
Yes, it's clear. Thank you.
Okay, and then the last point is basically like the most superficial to all these structures. You're gonna have the palmaris longus tendon, and that's gonna be joining over with the palmar aponeurosis. Aponeurosis is basically just like fascia that's going to be covering around this region, right? Right, now let's talk about the superficial nerves and the sensation. So when it comes to the superficial nerves, okay, so we're gonna be discussing two different points, the palmar side and the dorsal side of the hand. So the palmar side of the hand, on this, on the ulnar side or the pinky side, we said we're gonna have the ulnar nerve, all right? The ulnar nerve is going to provide sensation for the medial 1.5 fingers, half of this finger, which is basically this part of the finger. What the median nerve is going to provide sensation for the 3.5 digits, all right? Like just memorize it. Ulnar nerve provides 1.5, median nerve provides 3.5, 3 and the other half. Okay, now let's look at it in action. So let's basically discuss first of all the palmar side of the hand. We said the ulnar nerve is coming over from the pinky side, and it's gonna supply 1.5 fingers right here, 1.5. The median side, the median nerve is supplying 3, 1, 2, 3, and the other half, 3.5. Now this part is supplied by the radial nerve, but it's not as significant. The main, whenever you the main important one for the palmar side is the ulnar nerve and the median nerve. Ulnar nerve supplying 1.5, and median nerve supplying 3.5. 1, 2, 3, 1, 2, 3, and the other half. Now for the dorsal side, however, what's going to happen is that the tips of the fingers that were supplied by the median nerve will remain supplied by the median nerves. So I mean this side, okay. So so we said the median nerve supplying 3.5. So first tip, second tip, third tip, and the half. The ones supplied by the ulnar nerve are going to stay the same. So this is one, and then this is the other half. Or no, for like the dorsal side, okay. Let me go again. So on the dorsal side, we said the median nerve is supplying the tips of the finger, 1, 2, 3.5. All right. Now the other two nerves are the radial nerves and the ulnar nerves. They're going to split into two. Each takes 2.5 fingers. So the radial nerve is going to take the radial side, which is going to be 1/2, 1, 2.5, and the ulnar nerve is going to take 1, 2.5, and it's going to take the tip of the pinky because it was supplied. It doesn't have any type of supply by the median nerve. Okay. So again, sensation anteriorly, ulnar nerve gets 1.5 fingers. The median nerves gets 1, 2, 3.5. On the dorsal side, the tips that were supplied by the median nerve are going to remain supplied by the median nerves. The tip or the pinky that's supplied by the ulnar nerve is going to remain supplied by the ulnar nerve. And then for the dorsum of the hand, it's going to be split into two. The radial side is going to get 2.5, and the ulnar side is going to get 2.5. Okay, is it clear?
Yes, it's clear.
Okay. Rheumatoid arthritis is basically inflammation of the joints. You don't need to go so much into deep details about it, but basically arthritis is inflammations at the joints. There are other clinical scenarios that you're going to get that are more important than this. Okay, now I'm going to start talking about other concepts around the hand region. Do you have any questions when it comes to the muscles, the arteries, or the nerve supply at the hand? All right. So now the first thing we're going to be discussing is the carpal tunnel. Now, as we said previously, the carpal bones are creating this arch posteriorly. And then this arch anteriorly is going to be covered over by the fascia, right? Okay. Now, underneath this arch, we're going to have the flexor digitorum superficialis and profundus. This is like an important concept that you should know. The flexor digitorum superficialis and profundus are going, and the flexor pollicis, because the digitorums are supplying 1, 2, 3, 4. The pollex or the thumb is going to have its own flexor muscle from the hand, from the anterior compartment of the forearm. Okay. Now, the 4 flexor digitorums are going to be covered by a bursa, or like basically a sheath that's covering them, referred to as the ulnar bursa on the ulnar side. The radial bursa is going to be covering the flexor pollicis longus which is basically supplying the pollex or the thumb. It's a different bursa known as the radial bursa, and the flexor digitorum superficialis and profundus were supplied or like were covered by the ulnar bursa, right? Focus on these two, radial bursa and the ulnar bursa. Now, this is basically the carpal tunnel. As we said, it's going to have the 4 bones on the back, the carpal bones, which are going to be the hamate, capitate, trapezoid, and trapezium. The capitate is the one in the center. That could help you like C and C for the center. And then on the anterior side, we're going to have this fascia right here, which is known as the flexor retinaculum. The flexor retinaculum is going to be covering it anteriorly to create this carpal tunnel. Now, what are the points that you should know about the carpal tunnel? The first and the most important one is that the median nerve is passing inside the carpal tunnel. So any type of problems in the carpal tunnel will lead to compression of the median nerve. And if we compress the median nerve, we're going to lose the functions of the structures that are supplied by the median nerve, right? So median nerve passes inside the carpal tunnel, and any types of problem in the carpal tunnel are going to compress the median nerve, which is going to lead to dysfunction of the structures supplied by the median nerve, which are the thenar, for example, and the 2 lumbricals, the 2 lateral lumbricals. Okay. Now, the next point is that, as we said, the flexor digitorum superficialis and profundus were covered by their own bursa, which is known as the ulnar bursa. The flexor pollicis longus is covered by its own bursa, known as the radial bursa. One more point is that the flexor retinaculum, as it comes over, it's basically going to create a different compartment for this one muscle tendon, the flexor carpi radialis, right? So the flexor carpi radialis has its own compartment. The flexor digitorum superficialis and the profundus and the pollicis longus are in their own compartment, but they differ in the bursa. Now, one way that you could use in order to like not confuse yourself with the flexor pollicis longus or the flexor carpi radialis, like which one is in the compartment or which one is in the radial bursa, you can think of the pollicis longus. It's similar to the digits, right? It's going over to the pollex and digits. They are flexing the digits. So they are going to be in their own compartment together. While the flexor carpi radialis, it like has the word radialis, and it's more about the radial side. Therefore, it's going to be in its own compartment. Okay. Now, one last point that you should know is that the ulnar arteries, the ulnar nerves, and the tendon of the palmaris longus, which went over here to create the palmar aponeurosis, all these guys do not pass through the carpal tunnel, right? The main significant component of the carpal tunnel is the median nerve. Now, another question that I saw like repeated in multiple books was this idea or like this concept about the digits. Okay, so we said inside the carpal tunnel, we're going to have the flexor digitorum superficialis and the profundus. When they first enter into the arm or into the hand, the flexor digitorum profundus are basically four tendons separated going into their locations. The flexor digitorum superficialis are going to create this shape, where the middle two ones are basically going to the middle finger and the ring finger are going to be more superficial, while the ones that are going to the pinky and to the index finger are going to be more lateral or more deep. Okay, so it's going to be like that. You can see them right here. So this one and this one are going to be the ones going to the middle 2 fingers, which is basically the middle and the index finger. And then the other 2, which are basically more deeper and under, are going to the index and the pinky. Okay. Now these are again the main points that you should know about the carpal tunnel. I wrote them down for you here: the median nerve, the 2 different bursas, and the compartment.
What's the significance of those 3-4 points?
The
Apart from the
most
median
important
nerve
one is the median nerve. These questions, like you might get a question that's basically telling you like what, like there is, for example, an inflammation in this part. 1 second, let me see. Okay, so there's an inflammation of this part, and then, for example, what structure has its own bursa that's going to prevent it from getting this infection. Then you could say that the flexor pollicis longus has its own bursa, so that's why. Right? It depends on the type of question.
So if there's a bursa in the flexor digitorum part, then all the digitorum tendons would be affected, apart from the bursa, the pollicis one.
Flexor pollicis, because it's in its own bursa.
Well,
I
so
brought some questions for you guys at the end, so you can see how they're going to be like.
So in a carpal tunnel, mainly median nerve is affected. There's no effect
In a
to
carpal
this.
tunnel, what is it?
In a carpal tunnel, mainly median nerve
Yes,
is
because the
affected.
median nerve is the only one that's passing through the carpal tunnel. The radial, the ulnar nerve and artery are outside the tunnel. The tunnel is basically this part, like everything that's under this part, the flexor retinaculum.
Can you repeat the bursas, ulnar and radial and stuff?
Okay, so there are two bursas, the ulnar bursa and the radial bursa. The ulnar bursa is basically more to the ulnar side, is gonna cover the four or like the two flexor digitorum muscles, the superficialis and the profundus. The radial bursa at the radial side is gonna cover the flexor pollicis longus, which is basically responsible for flexing of the thumb. Okay, and then one way to differentiate the flexor pollicis longus, which has its own bursa, and the flexor carpi radialis that has its own compartment, is by basically like trying to remember that the one that or like the flexor digitorum are responsible for flexing the digits, and the flexor pollicis is flexing another digit, which is basically the thumb, the pollex. While the flexor carpi radialis, it's like has a different name that's basically talking about the carpis and the radialis or the radial side. It's not related to the flexing of the digits. That's how you know whether how do you know that these guys are in the same compartment and that the flexor carpi radialis is in its own compartment.
Flexor digitorum has its separate compartment. Flexor pollicis has its separate compartment. Flexor
No, no.
carpi radialis has its.
Look, it's right here. You see how the flexor retinaculum is giving off this branch right here? It's creating two compartments. This one, which has the flexor carpi radialis, and then this entire branch that's going to have the median nerve, and it's going to have the flexor pollicis longus, and it's going to have the flexor digitorum superficialis and profundus. The flexor digitorum superficialis and profundus are covered by this sheath, which is known as the ulnar bursa. The flexor pollicis longus is covered by this sheath, which is known as the radial bursa. You can see it right here. So again, this is basically right here. This brown line is going to be the flexor retinaculum. It's going to give off this line, so to separate it to two compartments. The first one, which is going to have the flexor pollicis, the flexor carpi radialis, and then the other compartment for the digitorum superficialis and the flexor digitorum profundus, the median nerve, and the flexor pollicis longus. And these guys are covered by the ulnar fascia or the ulnar bursa, and the flexor pollicis longus is covered by the radial bursa. The ulnar nerve, the ulnar artery are outside the carpal tunnel. The radial artery is outside the carpal tunnel. The only main structure going through the carpal tunnel is the median nerve. Therefore, whenever we're talking about a carpal tunnel syndrome, which is the next point, carpal tunnel syndrome is referring to compression of the median nerve. Okay, so carpal tunnel syndrome is compression of the median nerve, which could be to many different reasons, such as fluid buildup, which could cause in the tunnel, which could cause like compressing on the median nerve. All right. You guys get this part?
Yes. Yes.
Okay. Now the next one, one second. Okay, so the next one is going to be the anatomical snuff box. So, okay, did I put? Okay, never mind. I thought I had a picture for the. Okay, so yeah, the anatomical snuff box is basically going to be found in this region of the hand, right here. This is the anatomical snuff box. What you should know is the borders of the anatomical snuff box and the contents and the floor. So the most important part are going to be the floor and the contents. And then the other thing that you should know are the borders. Now, the floor is the scaphoid bone, which, as we said earlier, is the most fractured bone. So whenever you have a patient who is basically coming through with a scenario that the patient has pain in the carpal tunnel region, or not the carpal, I mean the anatomical snuff box, and then it's going to be most likely a fracture of the scaphoid bone. Or if a patient came to you with a fracture of the scaphoid bone, how would you know? Because there is pain at the anatomical snuff box area. The other thing passing through the anatomical snuff box is going to be the radial artery. Now, let's talk about the borders real quick. So the medial border is going to be the extensor pollicis longus. Okay, yes. So the medial border is going to be the extensor pollicis longus. And then you're going to have the extensor pollicis brevis and the abductor pollicis longus. You can see them right here on the side. So the extensor pollicis longus medially, and then the extensor pollicis brevis and the abductor pollicis brevis laterally. Inside it is going to have the scaphoid bone, and less importantly, the trapezium bone. But mostly you should know that the floor is made of the scaphoid bone. And the contents are going to be the radial artery passing through the anatomical snuff box, which could provide a significance for radial pulse. You can check the radial pulse in the anatomical snuff box. Now, above or like superficial to the anatomical snuff box, you're going to have the cephalic vein. Do you guys know how to like memorize? So basically, there's two veins in the hand, the basilic and the cephalic vein. So for me, the way I remember them is by basically like taking my body as an A, the letter A, and then the first side is going to be the letter B, and then the lateral side is going to be the letter C. So A, basilic, and the cephalic vein. So the one on the thumb side or the lateral side is the C or the cephalic vein. All right. So the anatomical snuff box is in this region. So what's going to pass above it is going to be the C or the cephalic vein. So cross superficially by the cephalic vein, and some branches from the superficial radial nerve, which are basically sensory branches, right? And during a fracture, there's going to be the most pain at the fracture of the scaphoid bone. The most pain is going to be felt in the snuff box area. Okay, any questions about this one? All right. Now, the next clinical scenario is Colles fracture. Now, whenever you hear Colles fracture, basically you want to think of a dinner fork deformity. Colles fracture is a fracture of the distal radial bone, which is going to cause compression on the median nerve, and like alongside that, you might have a scaphoid fracture. But the main presentation for a Colles fracture is a fracture on the distal part of the radius that's going to compress the median nerve, right? And it's going to create a dinner fork deformity. Why is it basically going to be a dinner fork deformity? Because you have damaged the median nerve, and therefore the thenar muscles, the first two lumbricals, they are no longer going to be functioning, which is going to basically create this type of like presentation, which is basically a dinner fork. Because again, what was the function of the lumbricals? Flexing at the metacarpophalangeals and then extending at the interphalangeals. So you're going to have a patient who cannot do that. Okay. So Colles fracture is a fracture of the distal radius due to a fall on an outstretched hand. Fall on an outstretched hand is going to be coming over a lot when it comes to the upper limb, because basically a fall on an outstretched hand can damage the arm bones. It's going to damage the shoulder. It's going to damage the humerus. It's going to damage the scaphoid bone. So whenever you see a fall on an outstretched hand, you should think of this stuff, right? So again, it's a fracture on the distal radius, compressing the median nerve. And presentation is going to be a dinner fork presentation. This right here is going to be a fracture on the scaphoid bone. So this is the radius, which is going to be the large bone when it comes to the distal side. Now, on the thumb side, you think thumb, radius, and scaphoid bone, right? So this is a scaphoid bone right here, thumb, radius, scaphoid bone, and this is a scaphoid bone fracture, the most commonly fractured bone. And right beside it is going to be the lunate bone, which is the most dislocated bone. Okay. So on a scaphoid fracture, again, it could be caused due to a fall on an outstretched hand. And then you're going to feed the most tenderness in the anatomical snuff box because it's creating the floor of the anatomical snuff box. One more point that was brought in the lectures was the nutrient foramina. Basically, in the scaphoid bone, when there's a fracture, the nutrient foramina are basically supplying nutrients or like blood supply to the bone, right? So if you get a fracture in this part where both halves of the bone are still receiving blood supply, then it's going to be fine. If you receive a fracture at this part where one half has blood supply and then the other fractured part has no blood supply, what's going to happen is that you're going to get necrosis. What necrosis is basically just like the death of the bone because there is no blood supply. Okay, that was all, guys. You have any questions?
Thank you so much. That was well explained.
Thank you. So here are some questions for you guys to solve. So you want to try? Okay, so yes, the first question, the answer is C, the flexor pollicis longus, because we're basically describing the radial bursa. So the radial bursa is going to be the flexor pollicis longus. All right, the next question. Okay, so question 2, the answer is E, the deep ulnar nerve, because as I told you, you want to associate the thumb side with the thumb, the radius bone, and the scaphoid bone, which is the most dislocated bone, and then radial arteries and nerve. While the pinky side is going to be associated with the ulnar arteries and nerves, and the pisiform and the hamate bone, which are basically, this is the ulna. So this is the pisiform, and this is the hamate bone. The pisiform is a small bone that's going to be sitting on the triquetrum, right? So pisiform and hamate on the ulnar side for ulnar arteries and nerves. Okay, the next question.
Can you go back to the question?
Now the question, right?
Yeah. So it's not related to this question. If the question was the what do you say, the carpal tunnel, it's the capitate bone in the center, right?
The carpal tunnel.
Yep.
It's not going to be a question about which bone is fractured in the carpal tunnel, because like all these bones are creating. The reason I said like the capitate bone is in the center is, for example, when you're looking at an X-ray, right? So then like if they put an X-ray, they're like, what is this bone? This is the bone in the center, so this is the capitate.
Oh, okay. Okay.
Okay, so this question was clear, guys. Okay, I'm gonna go to the next question. Okay, so yes, the answer is C, the thenar muscles, because he's basically talking about the carpal tunnel syndrome, which is basically damage to the median nerve and the thenars, and the first two lumbricals, not the third and fourth. The first two are the ones supplied by the median nerve. Okay, this is the same concept again. So okay, different question. Yes, the answer for this one is E, the lunate bone, because you said which one is the most likely to be dislocated. Like this is the way you guys gonna get the questions in the exam. Like it's gonna be a long scenario with a lot of stuff, but then the answer is basically just one liner. Which of the following carpal bones will most likely be dislocated? Then the most commonly dislocated one is going to be the lunate. Which of the like also the lunate bone is attached on the radius. It's like if you don't want to just like memorize it, basically what happens is that since the lunate bone is like partly on the radius, whenever like there's any type of movement around here, it's gonna get dislocated. Okay. This was the question. Okay, so the next question. Yes, the answer is A, median nerve, because it's a fracture at the distal part of the radius. And what is the name of this type of fracture? What is it called?
Fork.
This is the presentation, but it is
The
known
Cooley's,
as, yes, Cooley's fracture. Yes,
Cooley's.
the presentation is the fork. All right, Cooley's fracture and the nerve fork deformity, distal radius and median nerve. Okay, yes, this answer is B, the anatomical snuff box, because we said it's going to pass posteriorly, anatomical snuff box, and only then it will going to start and then passing through the dorsal and trapezius muscles, the first one. Why we said the anatomical snuff box and why not the A? Because he said immediately after crossing the radiocarpal joints. So that's why it's B. The answer is B for this one. It's the lumbricals, and the presentation would be like in this form. Like lumbricals, always or like a person is doing this with his hand is done by the lumbricals. Yes, this one is A, the superficial branch of the ulnar nerve. It's right here. So the fifth digit supplied by the ulnar nerve. So 1.5, and then 3.5 for the palmar side. The dorsal side, the tips by the median nerve, and then 2.5, 2.5. Okay, guys, and this is basically the book that I brought most of the questions from. It's the Gray's Anatomy Review. I'd recommend you guys solve this book because when I was trying to get you questions, like I tried to go to all the exam questions, and most of them were from this book. So I suggest you guys solve this book before your MSK Anatomy midterm or final. Okay, yeah, guys, any questions?
No, thank you very much.
Of course.
No, thank you.
The digital nerves and the medial nerves are sensory. Yeah, probably. I think like you mean the 1 second. If it's going to the digits, then the medial nerve is supplying the sensory. You shouldn't really know that it's basically a digital nerve. All you need to know is that the medial nerve is providing sensation to these guys, or like to this area, and that it's supplying the motor function to the thenar muscles and the first two lumbricals. The anastomosis in the fingers. Okay, so let me open up the picture, you guys. Like 1 second, let me open up the picture. Okay, so I think you guys are referring to this one, right? Now, when it comes to the exam, it's not really an important one that you should know. Like mostly focus on the anastomosis around the scapula. Anastomosis around the elbow were not difficult. It's basically just the radial artery, ulnar artery. I think you should focus mostly on the ones around the scapula and the ones around the hip when you take the lower limb. These are like where like you're definitely getting questions from these ones. But for the ones around the finger, mainly you should know that there is a deep palmar arch, which we said was made by which artery? The radial artery, and the superficial palmar arch, which is basically made by the ulnar artery. So as the deep palmar arch, the deep palmar artery coming, or the radial artery, it's going to give off two branches. It's going to give off the one to the lateral side of the index and the one to the thumb, the principus pollicis and the radialis indicis, right? It's then also going to give off other branches, which is basically the palmar metacarpal arteries, or like other branches that are basically going over to anastomose with the superficial palmar arch. It's not really as important, again, as I told you. Just focus on the ones around the hip and the ones around the scapula. The ones around the hip and the scapula, yes. You should know them, that basically it is like, what is the anastomosis made of? Like it might come in the exam, right? So I'm telling you, like, focus mostly on the ones around the scapula and the ones around the hip. These ones, as I explained them to you, I'm gonna go over them again. Basically, 1 second. I'm gonna go over the slides I made for you. Okay, so can you see the screen? Can you see the presentation that we just used? Okay. So again, you have the radial artery, which is going to come over and create the deep arch. The deep arch is going to give off branches to the thumb and branches to the lateral side of the index finger, right? And then it's going to give off these palmar metacarpal arteries. The palmar metacarpal arteries, Why do you not see them like doing anything here? Because what they're going to do is that they're basically going up to anastomose or like connect with the superficial palmar arch, right? So we have the radial artery, which is this one coming over here, giving off the principus pollicis, giving off the radialis indicis, and then creating the deep arch where it's going to join or anastomose with the deep ulnar artery. And then it's going to give off these palmar metacarpal artery branches. These palmar metacarpal artery branches are then going to come over here. The palmar metacarpal arteries are going to anastomose with the superficial palmar arch. Now, the superficial palmar arch was created by the ulnar artery, which came over from this side. It gave off branches to the pinky finger, gave off branches to the middle or to the ring finger, to the middle finger, and to the medial side of the index finger, right? And then it joined up with the superficial branch of the radial artery. Now, what it created, or it received anastomosis from the palmar metacarpal arteries. Okay, so the palmar metacarpal arteries will anastomose with the common palmar digital arteries, which are basically coming around here, right? The first one's coming up, gonna be the common digital arteries, until they give off the proper palmar digital arteries, which are the ones supplying these fingers, right? So this is a proper supplying with this side and this side, and this is going to supply this side and this side and this side and this side. You guys get it? The only anastomosis that's basically happening, it's going to be that the deep palmar arch is going to be anastomosing with the deep ulnar artery, and then the superficial palmar arch is going to give off branches to the digits that are going to receive also supply from the deep arch, which is basically the palmar metacarpal arteries. And again, mostly it might come in the exam. Like, I don't want to tell you that it's definitely not coming in the exam, but it might come. But like the veins ones that you should actually focus that like you're probably 99% getting questions from are the ones around the hip and the ones around the scapula, which is basically this part right here. You might even get SAQ questions or like SAQ type of questions about like the hip and the scapula type of anastomosis. Anything else? Okay, the bursas. It's not that I need to explain them to you. Basically, you just have to memorize them. Okay, so you have you said going through the fingers, or like the fingers as they pass, or as the muscles are passing through the carpal tunnel, we're gonna have two sets of muscles. The flexor digitorum, the superficialis and profundus. These guys are going to be covered by one sheath or one type of bursa covering all of these guys. And this is going to be the ulnar bursa. Right here, you see. So the flexor digitorum superficialis, the flexor digitorum profundus, these guys are covered by the ulnar bursa. And then beside these muscles, you're going to have the flexor pollicis longus, which is going to go over to flex the thumb. And it's going to be covered by its separate bursa, which is going to be the radial bursa. How do you know that basically the radial bursa is for the flexor pollicis longus? It is because the flexor pollicis longus is going to flex the thumb or the pollex, which is over at the radial side. So it's basically covered by a radial bursa. Or the other guys are covered by the ulnar bursa. And how to differentiate between the flexor pollicis longus and the flexor carpi radialis is because the flexor pollicis longus, it's flexing the pollex or the thumb. It's doing a similar function to the flexor digitorum superficialis. Like all of these guys are digits, so they're going to be in the same compartment. While the flexor carpi radialis is basically a different name. It's the carpi and the radialis. It has nothing to do with the digits. Therefore, it's going to be in a different compartment. But mainly focus on the radial bursa, which is covering the one going to the radial side or the pollex, flexor pollicis tendon, flexor pollicis longus tendon, and then the ulnar bursa, which is covering the flexor digitorum superficialis and profundus. No worries. Do you have any question, guys? Any other questions? I think we're good right now. So we're going to end the meeting, guys. Thank you for attending. Hope you learned something new.